A leading multi-specialty Dr. L.H. Hiranandani Hospital in Mumbai, state-of-the-art robotic system for knee replacement surgeries. The launch ceremony was graced by Dr. Niranjan Hiranandani, CMD of the Hiranandani Group of Companies, as the chief guest, Dr. Sameer Kulkarni, CEO of L.H. Hiranandani Hospital, Dr. Manish Gupta, Medical Director, and Dr. Sanjeev Jain, a full-time orthopedic and joint replacement surgeon at the hospital, were also present. Dr. Niranjan Hiranandani, in his address to the media, highlighted the hospital's commitment to excellence. "We are proud to house the Center of Excellence for Joint Replacement," he stated. "Our team comprises some of the most esteemed orthopedic and joint replacement surgeons specializing in knees, hips, spines, and sports injuries. Now, with the acquisition of this robotic system, their expertise will be further amplified. This technology not only ensures exceptional accuracy and precision during surgery but also streamlines the entire process," Dr. Hiranandani emphasized. "It signifies the perfect blend of human skill set and cutting-edge technology, a combination proven to deliver the best outcomes and patient relief. Consistent infrastructure and technological upgrades remain a core focus for our hospital management."
To explain to you that we are now moving to the next level. So there is a positive story in terms of it. The details of that, I'm not the right person to share. So Dr. Sanjeev Jain, who looks after the entire department, and our other doctors will share with you what is it that we will bring to the patient care that we do. So ultimately, what is the idea of this hospital? Dr. L.H. Hiranandani was the founder, was Padma Bhushan, ENT surgeon who did a lot of ear, nose, throat work, and it is after his name that this hospital was created. But the idea was to see that we always bring patient care to the next level, and that is what we are very proud of. So today, this is one more step in that direction to which we are doing, and hence I am delighted to do. If there's anything question for me, I would love to do it, because then I will leave, and I leave you to the persons who are over here to take it. Dr. Sameer is the CEO of the hospital. Dr. Manish Gupta is the medical director, and Aditya Sai, who's in the sports medicine segment, is doing fantastic work, but excellent work that is happening. So they are the persons who will actually give you the further details, both of the equipment, the benefits of it. I know some of it, but I don't want to be the expert who really shares that knowledge.
Dr. Sanjeev Jain, joint replacement surgeon who will spearhead the use of the robotic system, elaborated on its benefits. "The robotic system eliminates variations between surgeons and facilitates precise cuts, minimizing tissue trauma and blood loss," he explained. Dr. L.H. Hiranandani Hospital's adoption of this advanced robotic system signifies a significant leap towards offering patients minimally invasive, precise, and efficient knee replacement surgeries.
This is the one part of the system which is a camera, and this is the other part of the machine which is attached to the table and works. Now, this is a robotic arm here, where when do a knee replacement surgery, there's a system which is saw works. Okay, there's a saw which cuts the bone. Now, what we do during the surgery on the knee, we put certain markers. There's a flow of the system or technique or technology which is catched by infrared rays by this camera and goes there, and everything is calculated precisely, or data is captured, okay, in this. This data is integrated with this system where robotic arms start working. Now, when my knee is like standing like here, when I switch on this system, the robotic arm automatically comes there to the knee joint and give me where the cut has to be done accurately, precisely. So I can precisely cut where, okay, using this robotic arm and the saw. So there are many cuts to be made to the bone one. The same time when I put the component inside, how well they are placed, how they are aligned inside is been seen. And then finally, the soft tissue titration or the release, because it's a biological kinematic joints, knee has to bend and function. Okay, so it has to be a stable joint with all soft tissue balances in up to the complete degree of bending in all the planes. And that is also precisely accurately seen on table live on the screen. Now, if you find as a surgeon there's something is not correct, you can rectify there, and you can see the rectification effect on the screen, what is happening. Great. So that can give you again a very precise cuts, very precise alignment, soft tissue balancing, good kinematics of the knee. So you can predict excellent long-term results, better function for the patient, better recovery. And of course, when you align everything correctly, all the things are balanced correctly, the patient will definitely have a less and moderate pain or no pain. So there is many benefits from using this system, and I'm sure that this technology is going to at least do good for the Mumbai's patient. And it's not that the other hospital doesn't have, we want to name that, but we are going to definitely have an edge on any of the hospital in robotic knee replacement surgery, because we have been practicing for 20 years in the hospital. As myself, I was practicing for 33 years in joint replacement surgery. So I can deal the robots like a baby, okay? And it's not that the robot is going to do the surgery, it's a surgeon assisting the robot doing the surgery. Then only it can be done.
Since there are two knees to be replaced,
Yes.
so pair of knees.
Yes.
So how much duration it takes for changing the other pair?
So basically, technically, see, it again depends. It's not that duration of the surgery is very important, but on an average, we take around half an hour to 45 minutes to do one knee.
One knee. Okay.
When we use this system, you might use 10 minutes more, because you need to put the system into the place and other thing. 15 minutes more, 1 hour you can see. But as you do more and more number of surgery, though we were doing computer navigation since 2006 in this hospital. So for us, it's not a new, but it's a robotic arm which is going to assist us. Okay, so our time will be practically the same, maybe 45 minutes to 1 hour for one surgery. Other knee is the same, because you have to just do the other side. Both the knees can be done same way.
And both can be done simultaneously, or does it take
So we do most of the patient, more than 95 to 98% patients simultaneously, who needs it,
Okay.
who is ready for it, who is willingly ready for bilateral knee replacement simultaneously, same day, same go. After doing one knee, other knee, same
Other
day.
knee, same.
Okay.
Thank you.
And we have a lot of benefits. We have come up with a system where we keep the patient's safety. See, why the patients are afraid for bilateral knee, but they feel it's not going to be safe. One, they'll have a lot of pain. Two, they will not be recovered faster. Three, but we have overcome all these possibilities, and they have no pain. They can recover the same way, and of course, they are managed beautifully, because we are working in an institution, so they are backed up for all the complications which we can predict, which will not happen, and we touch wood, we have no complication. So we can safely do it. We do the very thorough cardiac, especially the cardiac checkup, where we can determine that anything which will not affect their heart condition. And if that is the case, we defer the surgery, and we ask them to go for a cardiologist to see, and then if everything is okay, then we have a surgery.
So what is the success rate of this?
So, see, the literature talks about two ways. Percentage, people ask, कितना percentage होएगा? पर medical science में कुछ percentage नहीं होता है. We talk about, good, moderately, okay, or better, or excellent. So far, we have been able to produce an excellent result with no complications in 20 years for any of our patients. And this can be found out. We can challenge it openly by talking to any of number of patients randomly.
But are there any risk or complications involved in this robotic system?
In general, no. In general, no, because that's very important question. Okay, because it's like somebody who's driving, he doesn't know even the driving, has been given the BMW and Audi to drive, and that went Mumbai road. So if you have an experienced team, experienced surgeon, who has a good training, who has enough experience doing a non-robotic things like conventional thing, then that surgeon can perform very well. So it's like, if you don't do it, it's like GIGO, like garbage in, garbage out. Whatever is going to feed the data for the system, that will come out. So with an experience, if you don't feed it, you will have a problem. But in general, they are designed so well, usually there is no problem at all whatsoever, you say. So there's no complication as far as, of course, this system also has a boundary, like when a bit of bone, beyond that marking, this marking has to be done, there is shaping has to be done, morphing has to be done, morphing has to be done. So beyond that line, if you go, the saw or the system will stop. So it will not cut which is not required. So definitely we need to use our brain, robotic, artificial intelligence and experience there.
So is there age age का क्या है कितने साल से कितने साल तक because there are older people who don't want to like they are hesitant for knee surgery or like
Yeah. So see, it depends on see if patient is medically fit, okay, and if they are able to sustain the surgery and they're willing to undergo, we can do the surgery. The highest number of age we have done it in this hospital, both the knees, 104 years.
Great.
One shot. So is your Saudi patient who went away last September from here. Okay, the patient wanted to do it. He was very painful. He was on the bed for many years with the pain. They wanted him to even painless on the bed. Forget about anything. Okay, recently I have done a hip replacement for a 111-year-old patient in this hospital. Patient is still in the hospital. So its age is not the criteria. Patient has to be mentally fit, physically fit, and of course medically fit. Surgeon should have guts to take that challenge, and of course your anesthesia team and system behind who's backing up should be able to take that challenge.
and how is financially viable for people like as compared to normal
See, financially, naturally, it's cost, technology cost. Okay, these are costly machines. I don't want to disclose the cost. Okay, but definitely. So may I invite my anesthesia team colleague also here, who is Dr. Shobit. They are wonderful people for this kind of subset of patient. When we, of course, every subset of patient, but especially when you asking the high age patient. Okay, so they are our backbones. Without them, we cannot work. But your question was, sorry.
about the
Cost.
Cost will be definitely little more because we have to recover the cost of only the machine basically, which is costly. So and the consumable, there are some trackers, the material which are costly. We may not recover the cost of the machine, forget about it, because we can absorb that cost. But at least the consumable which comes so around, you can say it varies from hospital to hospital. But we may charge one surgery, maybe I'm not sure, I've not decided, but at least some more extra money. Yes.
How many years does the implant last?
So I've been practicing for 33 years, so I've not seen any failure so far, so touch wood. So I can say 25, 30 years they last, even more than that. More than that. Again, if you don't do precisely or accurately, it will not last. So there where adds the edge. Like if you say the conventional way, the survivorship is 95% for 15 years. With your robot, if you use, then you might say it will be 98% for 50 years. So 98% of the knees will survive. So at least there will be definitely edge. Technology will add.
And how long does it take to walk normally?
They walk same day.
Same day. Wow, great.
They walk same day. We are talking about discharging them on the same day. So all our patients, whether the one knee is done or both knees done, they stand and walk same day. Of course, it varies from patient to patient also. It's mindset of the patient. They are not as I say, same day. The patient was the same day. The mindset is not there. So they will not walk. You have to prepare them. So we have a pre-operative counseling for them. And we talk to them, hi, how are you? I'm coming to that. So the counseling is part of one of the pathway, which is called a clinical care pathway, where we have developed a system for the last 15 to 20 years, where what we do is basically where we counsel the patient preoperatively. Okay, our pre-anesthesia people, anesthetist people, they talk to them. Okay, our physiotherapists talk to them that what will happen when they are in the hospital. So they come with a prepared mindset. Okay, and of course about the pain. The pain is basically everything is in the mind game. So you must have seen so many cancer survivor patients. Like somebody has bad cancer, but he survived, and somebody has even hardly anything in the cancer, and every possible treatment then could not survive. So reason is that everything is the mind, and everything is the mind. That means when your mind is set, your whole body or biology works that way to fight. Okay, you give the medication, but when your mind is set, your biology is set, everything is going to trigger and hit that thing, which is not good for the body. That's why I say everything is in the mindset. So mindset of the patient, if it's correct, then pain is practically nil or negligible. Because pain is a perception. If I was hit by somebody, I may not cry because I'm a tough man, but somebody hits this guy, he may cry for 10 days with the less impact even. So it's the patient perception for the pain is different. But once we convince them, and we can also, what we do is we ask them to give randomly, if you wish you can talk to some patient who has been operated. How was their effect? We don't say there won't be any pain. It's a human body, there will be some pain. But it's negligible or no pain. That's why we are doing our 95 to 98% patient both knees together same day, because we control the pain. Not with the medication, with the anesthesia department, with all the time together, but we also control by setting their mind. Correct.
So how many surgeries you have performed in this hospital?
That's
Approx.
So, करीब 7,000 होगा और ज़्यादा भी होगा.
Great.
So when you operate from this robotic arm,
Yes.
and then normal procedure, then
Yeah.
how much time you can reduce?
Reduce in with the robot. See, robot से थोड़ा time ज़्यादा लग सकता है. We were talking about, they asked this question before. But when you do more and more surgery, I've been doing computer navigation for many years. So our non-computer or computer is practically no difference. So robotic also you can take at least little more time sometime. Okay. People talk in general wrong because it's a system. You're adding to your procedure. Okay. So it will take 10 minutes or 15 minutes more. But with the time we can also match your non-robotic time. No.
And you can also reduce the blood loss or something like that?
Yes, blood loss. See, basically when you cut the tissue less, naturally there will be less blood loss. Okay, when you cut once the bone, you have less blood loss. Okay, so it depends. Okay, but blood loss is definitely less with the technology when you use it.
And this is the only robot here in this hospital, or is it in Bombay you will find somewhere else also?
See, there could be a couple of robots in Mumbai. I'm not saying that I've told to them, but I told them what is the advantage of using a robot in this hospital. We have been doing for 33 years. I've been practicing for 33 years in this hospital, 20 years. Okay, so you can have a grades of pilots, who can fly the better flight. The high risky, okay, airports like somewhere in the country, you will see the Facebook and see there are some, आजकल दिखाते हैं ना, वो कोई flights है ऐसी भयानक जगह पे उतर रही है आप सोच भी नहीं सकते, और वो flight को चलाने के लिए जो pilot बैठा है, that's very important. So we have it here. We have been doing years together, and we can do a better, definitely a better job than available. Anywhere.
Doctor, does this system require any calibration after every
Yes,
surgery?
it has to be calibrated. During the surgery, it has to be calibrated. Data has to be fed. That's how it comes. So there's the whole flow of the system.